Well, let's start off with what Nomid stands for. So it's neonatal-onset, multisystem inflammatory disease, which really tells you what this disease is all about. And Nomid is part of an umbrella term known as CAPS, which is cryopyrin-associated periodic syndromes. And it's the most severe form of CAPS, the first being FCAS, the second being Muckle-Wells, and the third being Nomid. And once again, Nomid is a rare genetic condition that is due to a genetic defect, a mutation in a specific gene. And as a result of that, it produces very high levels of interleukin-1 or IL-1. And IL-1 is a pro-inflammatory cytokine. And what IL-1 does is it increases the inflammation throughout the body. And so what patients typically present with is fever, skin rashes, arthritis, and then the inflammation can spread to key organs, the brain, the lungs, the heart. So it really can affect all organs in the body at a very young age in these patients. So once again, these patients often present in their early life, and they could present a number of different ways, and sometimes it's not that easy to diagnose these patients. They'll come in with very non-specific symptoms, fever, rash, arthritis, and that's why it is quite challenging for the physician to move through that differential diagnosis to arrive at a diagnosis of Nomid. And very often this is done through genetic screening, or it's just managed by physicians that are expert in this rare autoinflammatory disease space.